my name is Allison McMillan, RN, and today I'm going to discuss pulmonary arterial hypertension. Pulmonary arterial hypertension, often referred to as PAH or PH, is a disease caused by an abnormal elevation in the circulation pressure of the pulmonary artery. Diagnoses are made when the mean pulmonary artery pressure is greater than 25 millimeters mercury or higher. So here we have a healthy heart. You can see the right atrium, right ventricle, left atrium, left ventricle. The walls of the heart around the ventricles are the same size, nice and even. You see the pulmonary artery, which measures at 5 centimeters and has a normal mean arterial pressure of 15 millimeters per mercury or lower. And you can also see that it's nice and open, so it's going to have good blood flow. Over here with the heart that's affected with the PAH, you're going to see the enlarged right ventricle. You're going to see hypertrophy around the ventricle and the wall of the heart. And you have to remember the heart is a muscle. When you don't use muscle, it turns into flab, fat, and doesn't work appropriately. And so you'll see that in the wall right here. Also, you can see the damage to the pulmonary artery, and this is going to decrease blood flow, therefore making the pulmonary arteries that go out to the left and right are going to be thin and fragile. Some signs and symptoms of pulmonary hypertension include shortness of breath at rest and exertion, fatigue, dizziness, syncopal or fainting episodes, chest pain, exercise intolerance, swelling to the ankles, legs, abdomen, and face, and cyanosis, especially around the lips, and that's going to be due to the lack of oxygen. PAH is idiopathic at times, however, it does have sometimes where it's related to hereditary because of gene mutation. Also, there were some diet drugs in the 70s and 80s like fen-phen that were causing a lot of people to get diagnosed with PAH. Those have since been removed from the market. Some diseases that have an increased risk of developing PAH include HIV, connective tissue diseases like lupus, congenital heart defects and diseases, portal hypertension, left heart disease, pulmonary veno-occlusive disease, lung disease such as pulmonary fibrosis, and obstructive sleep apnea. So how do you diagnose PAH? Sometimes you can diagnose it with an echocardiogram or a CT of the chest. However, the right heart catheterization is the golden standard for diagnosing PAH. Some medications that help manage the effects of PAH include digoxin, which helps the heart contract better and pump more effectively. Diuretics like Lasix and aldactone help to reduce the extra fluid in the body, which reduces fluid around the heart and helps the heart not work so hard. Warfarin, Coumadin, and aspirin are all blood thinners and help prevent clotting. And then, of course, there's oxygen that help with hypoxia. So there are 3 pathways that have a part in the cell proliferation and vasoconstriction in the pulmonary arteries when PAH is present. So you'll see patients on multiple types of medications. One such type of those medications is prostacyclins. They help to increase the level of prostacyclin, which is a vasodilator. Flolan, Remodulin, Tyvaso, and Orimetrin are all in this class. Flolan is a continuous IV infusion. It cannot be stopped for more than 15 minutes or the patient will die. It also must be kept cold at all times, so you have to have ice packs all the time to keep the pump cold and the medicine cold. Remodulin is a continuous IV or sub-Q infusion. However, it is stable at room temperature, so it's a little bit better for the patients than the Flolan. Tyvaso is an inhaled version, and Orimetrin is an oral version. There's also endothelin receptor antagonist, Tracleer and Letairis. Those both come in oral forms. And then also PDEV inhibitors, Revatio and Adcirca. Those are also oral treatments. So what's the prognosis for pulmonary hypertension? Currently, there is no cure for pulmonary hypertension. Most of them need to have a lung transplant if they survive that long. Also, cost of medications. A lot of times these medications cost upwards of $80,000 and $100,000 a year. Also, awareness in the medical community needs to improve because there's such a delay in onset to diagnosis. I hope that I have been able to educate you a little bit on pulmonary arterial hypertension today. Thank you.